Hello everyone, welcome to the today's session. We will be discussing dermatology today. We will start with the dermatology basics first. Okay, so let's see if students are joining or not. Am I clearly audible? Okay, so we will start today's discussion of dermatology basic. Dermatology is a very important short subject. You will be asked at least 5 to 6 MCQs from the dermatology. I always tell my students that dermatology is a very important subject. The reason is it is very easy to revise. Okay, so this FMG exam, which is a screening exam, they don't want you to be a dermatologist, but as a MBBS doctor, they want you to know a basic dermatology. And in this basic dermatology, they are not going to ask you very tricky question. They are only asking very straightforward questions. Okay, and that is why these 5 to 6 MCQs or 5 to 6 marks are very important. Okay, to get an extra edge in your exam, you will be easily scoring this mark from these short subjects. So I will always tell my students that always study these short subjects thoroughly. So in this dermatology series, you will be very confident once you go through this lecture, and you will be able to solve all the MCQs from INI-CET, NEET PG or FMG screening test, the MCQ which was asked previously. Okay, having said that, let's jump to the basic dermatology first. It is very important. The reason is, if you know the basic anatomy of the skin, then it will be very easy to learn pathologies. Okay, so we will be making a basis of how we are going to learn. So the first is skin. Let's understand what the skin is. What you know about the skin, the basic understanding of the skin, you all know. The skin, or human skin we can say, is the largest organ of the body. It is a human skin is the largest organ of the body. Good evening, Sachin. Good evening. Yes, it is the largest organ and also protective in the function. Thank you for joining, Sachin. So, another question: what is the approximately weight of the skin? So, if you weight only the skin, what is the approximately weight it will be? The approximately weight will be 4 to 5 kilogram. 4 to 5 kilogram. What is the another main function? Let's understand. Main function of the skin. Sachin, am I clearly audible to you? Or is it lagging behind? The main function of the skin, I will say it is a barrier function. The main function of the skin is a barrier function. It is a barrier against infections. It is barrier against the infection. And also against the water loss from the body. If you do not have the proper skin, what will be happening? You will be losing water from the body. If there is no covering, outer covering of the, there is no outer covering of the skin. It is also protective against ultraviolet light. Yes. So, Sachin, which structure of the skin is protecting against the UV light? Which structure is protective against the UV light? Which cell protects us? Melanocyte. Always remember, and that is why we as an Indian, because we have a brown skin, we are naturally protected. We are naturally protected from the skin cancer because of this melanin production. Because of this melanin production, we are naturally protective against this UV light. Okay. Yes, but in epidermis, melanocyte. Okay, in epidermis there is a cell which is known as a melanocyte. Melanocyte produce melanin, and this melanin protect against the UV light. That is why you will see many cases of skin cancer in a white population, whereas in India or any country who has a brown or a black color skin cancers are not common. Always remember this. We will be learning this in a quite detail, but remember this important function. Another important function of the skin is vitamin D synthesis. Another important function is a vitamin D synthesis. You all know sunlight is very important for the vitamin D production. Yes, brown Munde, brown Munde rocks. Vitamin D synthesis. Vitamin D synthesis is occurring because of the skin cells which are keratinocytes. Keratinocytes. Skin is an important barrier. What is the main immune cells? Which immune cells are present in the skin? Which immune cells are present? So in pathology you will be learning that in liver there are antigen presenting cells, right? Every organ has their antigen presenting cell. Like this, skin also have some antigen presenting cells. Anyone know what are these antigen presenting cells of the skin? This is a Langerhans cells. This is a Langerhans cells. Langerhans cells are important cells it gives a immunity. It gives immunity. Apart from this, another important function is the temperature regulation. Temperature regulation by the production of sweat. So Kupffer cell in the liver. Yes, yes. Antigen presenting cell in liver is a Kupffer cells. Nice. So temperature regulation is occurring because of the acrine sweat gland. Okay, acrine sweat gland. Clear? Apart from this, temp sensation, various sensation transmission. There are special nerve endings in the skin which transmits the sensation to the spinal cord, right? So what are these main sensations? These are the pain, temperature, pressure, and vibration. These are the sensations. These are the sensations which is transmitted by the skin. It is transmitted by the skin. The body odor. So our skin also gives us a body odor. Anyone know which gland is responsible for the specific body odor of a person? Which glands are involved for the specific body odor of the person? This is the apocrine sweat gland. This is the apocrine sweat gland. This apocrine sweat gland is responsible. It is a apocrine layer. So generally what happens, apocrine glands are mainly in the axilla, areola and the perineum area. Generally sweat is not having any odor, okay, but the bacteria which are here, because of the bacterial metabolism, we have a particular odor of our sweat, and this sweat is from the apocrine sweat gland. Okay, so let's now dive into how we are going to learn about the skin. We discussed the major functions of the skin, right? So let's discuss what are the main anatomy of the skin. The main anatomy of the skin is, so what we will be doing is, we will be learning about the important three layers of the skin. The first uppermost layer is the epidermis. So the skin is divided into the first uppermost layer is the epidermis. Below it there is a dermis. And then we have hypodermis. Mean we will be learning about these three layers of the skin: epidermis, dermis and hypodermis. Generally this epidermis is derived from, epidermis is derived from ectoderm, and dermis and hypodermis is derived from mesoderm. Generally, in the hypodermis, you have these fat lobules. These are known as a fat lobules, and in between they have a septa like this. They have a septa like this. This is also known as a paniculus. This is also known as a paniculus. Good evening Khushbu. This is also known as a paniculus. Clear? So we will be learning about the first layer first, which is a epidermis. Epidermis is the first uppermost layer. Below it we have a dermis. The third downmost layer of the skin is a hypodermis. We will be learning about the epidermis first. Epidermis first. अभिषेक वेलकम वेलकम. हाँ यार पूरी कर देंगे. Every week we will be having a session, and in few weeks we will be finishing this dermatology completely. Okay, and make sure you attend these online classes, so you don't have to sit separately to study dermatology. I want that this dermatology become very easy for you. It is very easy subject to revise also. Okay, after reading this note you will be very sure to get your 5 marks in your exam from the dermatology. Come, let's get some burgers. Yeah, there are many mnemonics you can use. Okay, so let's understand this, how it looks like. What we just discussed is, in dermatology we will be learning about the epidermis first, which is the uppermost very thin layer. Below it we have a dermis, and below it we have a hypodermis. Below it we have a hypodermis. So now what we will be doing is, see this MCQ. Abhishek, if you can attempt this MCQ, what is a correct sequence? What is a correct sequence of the layer of the epidermis? What you will answer? From the downmost layer to the uppermost layer, what will be your answer? What is the correct sequence of the layer of the epidermis? So generally these are the arrows. Okay, these are the arrows. I don't know why it is converted into question mark, I don't know, but understand this. This is a from the stratum basale, then we have a stratum spinosum, then we have a stratum granulosum, then we have a stratum lucidum, and then we have a stratum corneum. यार तो तुम लोग तो मास्टर हो गए, सचिन और अभिषेक. चलो झंडे गाड़ दिए. D is the right answer. D is the right answer. So let's understand these 5 important layers of the skin. See this. The first layer is a basal layer. The first layer is a basal layer. Above the basal layer, we have a prickle layer, prickle cell layer, which is also known as a spinous layer. Then we have a granular layer, and the uppermost horny layer is known as a corneal layer. Uppermost is a corneal layer. So what I will be doing is, I will draw a graphical representation of all these layers of the skin. Okay, all these layers of the skin I will draw from the lowermost corner. So suppose this is the basement membrane. This is the basement membrane. On the basement membrane, we have the vertical cells like this, which are nucleated and active cells. These are the nucleated active cells. So on this basement membrane, this layer is known as a stratum basale. Stratum basale. Because these cells are nucleated and actively dividing, this layer is also known as a germinal layer. This layer is also known as a germinal layer. In this cell, in this layer, always remember columnar cells are present. And what is another important feature? It has a least amount of keratin. The keratin content is least. So they can ask you in which layer the keratin amount is least. The least amount of keratin is found in a stratum basal layer or a germinal layer. Now here comes one important MCQ. This is the basement membrane, and on the basement membrane there is one important protein which binds this vertical cell layer, vertical cells to the basement membrane. So Abhishek, do you know what is the name of this protein? What is the name of this protein? So guys, try to answer. I'm reading your answers. Anyone? What is a protein which helps in attachment of these vertical cells to the basement membrane? What is the name of this protein? I will give you one important MCQ based on this. This protein which binds these vertical cells is known as a hemidesmosome. Yes, Sachin, You have to understand that this is not desmosome. This is a hemidesmosome. This is the main mistake students do. There is a difference between hemidesmosome and desmosome. The protein which is involved in attachment of the basement membrane to the vertical keratinocyte, this is known as a hemidesmosome, the main protein. Now tell me a disease in which antibody against hemidesmosome is produced. A very important MCQ. Very important MCQ. Antibody against hemidesmosome is seen in a bullous pemphigoid. Yes, Abhishek, it is a bullous pemphigoid. It is a bullous pemphigoid. Clear? So these are important MCQ we discussed here. Stratum, for the stratum basale. In skin, always remember what will happen. Stratum basale will give the cells to the upper layer. So what will happen is this cell will divide, and now this cell will grow. This cell will grow, and here we have polygonal shaped cells in a second layer. And what you will notice is in these polygonal shaped cells, it has a spikes like this. It has a spikes like this. Now Sachin, what you were telling me is about this spiky material. These spikes are known as a desmosome, and these desmosome are the spikes. What these spikes do? With the help of these spikes, the two keratinocytes are stretched, and because of this stretching, they are not round, they are polygonal shaped. And because of this polygonal shape, because of the stretching from all the sides, you will see a particular shape of this, and because of these spikes, the name of this layer is a stratum spinosum. Okay. Yes. Welcome Dr. Jatin. Welcome Dr. Jatin. So this is a stratum spinosum, and this stratum spinosum is also known as a prickle layer of the skin. This is also known as a prickle layer. Now the antibody against desmosome. Okay, what we discussed, antibody against hemidesmosome. Now antibody against desmosome is seen in which disease? Antibody against desmosome, pemphigoid bullous we already discussed. This will be the pemphigus vulgaris. This is a pemphigus, the disease is a pemphigus vulgaris. Okay, so stratum spinosum or prickle layer, antibody against desmosome is seen in a pemphigus vulgaris. Always remember, they can ask you desmosomes are prominent in which layer? It is a prominent in a stratum spinosum because it is having a spines. Now remember another important name of this desmosome. In the Latin, I will use this word acanthos. Acanthos. So when I say acantholysis, means there is a damage to the desmosome. We will be using this term in many diseases. So if you are familiar with this term, the understanding of the disease will become very easy. What is the meaning of acantholysis? Acantholysis means damage to the desmosome. Okay. Now, as I told you, all the cells from the basal layer went into stratum spinosum. From the stratum spinosum, we have another third layer in which these cells become horizontal shape. They are still nucleated cells, but in this nucleated cell, there is a production of the granules, and these granules are in between this keratinocyte, and because of these granules, this layer is known as a stratum granulosum. This layer is known as a stratum granulosum. It contains keratohyalin granule. It contains keratohyalin granules. It has in this keratohyalin granule, there is a protein which is known as a filaggrin. It has a protein filaggrin. And these keratohyalin granule, the second MCQ they ask, it is produced by which bodies? This is produced by Odland body. Odland body. So you will notice that these keratohyalin granule is very important. It will give you a protection. Like a brick and a cement model, it will give you a proper protection from the pathogen which are coming from the outer environment, and it will also prevent a water loss from these gaps between the keratinocyte. And that is why if this layer is disturbed, patient can easily get dermatitis. Okay, if this barrier function is disturbed, so important barrier function. It gives you important barrier function, and it is disturbed in atopic dermatitis. It is disturbed in atopic dermatitis. Okay, up to now these three layer, and very important MCQ they ask, this stratum granulosum is absent in two disease. Anyone know, students, in which disease this layer can be totally absent? So if you want to remember like this, whenever you pinch your skin, can you feel some greasy consistency of your skin? Okay, your skin always feels some greasy, right? This is because of this stratum granulosum. But if you see a patient of psoriasis or ichthyosis vulgaris, you will see this patient has a very dry skin on the affected area because they have a absent stratum granulosum. So that is why it is a very important. This is a psoriasis. This is a psoriasis or ichthyosis vulgaris. This is absent. In this, you will notice So you will notice that this layer is absent. Okay. After this, as I told you, always remember from the stratum basale, cells went into a second layer, which is a stratum spinosum. In stratum spinosum, what is prominent? Spikes are prominent. From the stratum spinosum, cells are going into the third layer, which is a stratum granulosum. Very easy to remember, the granular layer, because of the granules are produced. These granules are the keratohyalin granules, and these keratohyalin granules are produced by the Odland body. Okay, now what will happen when these cells go into the other upper layer? So what will happen? This layer is known as a stratum lucidum. What is the meaning of lucid? Lucid means transparent. Lucid means transparent. So this is a transparent layer. This is only on palm and soles. This is only present on a palms and soles. One important MCQ recently asked, it has a LA in one of the exam, the option was given. Okay, this has a LA granules, and this granule makes these cells transparent. But as you can see, in all the first three layers, the cells I draw has a nucleus, but here in the fourth layer, these cells are non-nucleated. So these are degenerated cells. They are degenerated cells. The cells are dying, they don't have nucleus. They do not have a nucleus. Okay. So this layer, stratum lucidum, is only present on a palm and sole. Now these cells will become extremely dehydrated and pile up in the uppermost layer of the skin. Okay, so this is a pile ups. These are the totally dehydrated cells which pile up in the uppermost layer, which is known as a stratum corneum. Stratum corneum. And why this is known as a stratum corneum, anyone? Abhishek, Sachin, Medico. So you will notice that these cells are coming into the uppermost layer of the skin. It is a stratum corneum, and this stratum corneum is a flat layer of the keratin. Don't worry, Sachin. After attending this lecture, I am sure you will get a 5 out of 5 in dermatology. Okay. So generally student think that यार रट्टा मार लेंगे, थोड़े से ही एमसीक्यू होते हैं, क्यों क्लासेस अटेंड करना. But see, because of our experience, what we will be doing is we will be simplifying this short subject. If you try to learn on yourself, तुम्हें खाली रट्टा मारना पड़ेगा. But what we will be doing is we will be making this subject quite easy to remember, so you get 100% out of it. So ये शॉर्ट सब्जेक्ट्स को लाइटली मत लो. ओके. थोड़ा सा ही टाइम देना है, ये क्लास खत्म होने के बाद इट विल बिकम वेरी इजी टू रिमेंबर. ओके, and I will give you a short material to revise it every weekend. So by the time exam comes, you will be master in dermatology. Okay. So first of all, understand what we discussed is in the lowermost layer, which is the stratum basale. In stratum basale, we said there is a least amount of keratin. Keratin सबसे कम है. But as we go into the uppermost layer, which is a stratum corneum, we say it has a maximum amount of keratin. Because it has a maximum amount of keratin, we say corneum. Because these cells are dying, and these dead cells, because of these dead cells, they only have a high amount of keratin inside it, and because of this is known as a stratum corneum. It is a flat layer of keratin. It only has a dead cells. Or I can say these are the dehydrated cells. ओके, सो यस मेडिको, बस यही मेरा काम है कि तुम लोगों को डरमा अच्छे लगे और खेलते खेलते फ्री टाइम में आप डरमा पढ़ लो. ओके, एकदम से आपको बैठना नहीं पड़ेगा. 1-2 दिन के लिए आपका कोई टाइम वेस्ट नहीं होगा. शांति से ये लेक्चर सुनो, इसको धीरे से रिवाइज करते जाओ. धीरे धीरे एग्जाम आने तक डर्मेटोलॉजी में मास्टर हो जाओगे और 5 मार्क्स पक्के आपके. So these are the dead cell and dehydrated cells. Now tell me this MCQ. If you understand up to this, try to answer this MCQ. Which layer of epidermis is underdeveloped in very low birth weight baby? क्या जवाब दोगे? Which layer of the epidermis is underdeveloped? यस, आंसर इज अ स्ट्राटम कॉर्नियम. हमने क्या बात करी थी? स्ट्राटम बेसाले, स्ट्राटम स्पाइनोजम, स्ट्राटम ग्रेन्युलोजम, स्ट्राटम lucidum and stratum corneum. This is how skin develops from the basal layer to stratum corneum. In low birth weight baby or a premature baby, what happens is generally from the stratum basale cells go into the uppermost layer, and this is how our skin develops. So if the baby is born early, the upper layers of the skin will not be formed properly, and because of this a premature baby or a very low birth weight infant are very prone to get dehydration very easily, because the skin is not formed properly. They lose too much water from the body. Okay, that is why they are very prone to develop hypothermia also, and they are easily get dehydrated. यस सचिन, प्रीमेच्योर बेबी में स्ट्राटम कॉर्नियम ठीक से डेवलप नहीं होगा. सो हाउ यू विल रिमेंबर दिस लेयर्स? देयर आर मेनी mnemonics out there. Boys says girls looks cute. Okay, this is how you will remember. कोई पार्टी में जाते हो तो देख के बोलते हो ना, बॉयज सेज टू अदर बॉयज, बॉय सेज गर्ल्स लुक्स क्यूट. यहां पे यही याद रख लो कि ऐसा ही बोलते हो, बाकी भले कुछ भी बोलते हो. boys, for the stratum basale, stratum spinosum, granulosum, lucidum, and the uppermost is a stratum corneum. Okay, so we discussed about the main 5 layers of the epidermis. कोई नहीं यार, अलग अलग नेमोनिक होते हैं, है ना. सो जनरली what you will learn is epidermis turnover time. Okay, what is the epidermis turnover time? From the stratum basale, my cell reaches the uppermost layer of the stratum corneum. Okay, this is known as a epidermis turnover time. Epidermis turnover time. Epidermis turnover time. From the stratum basale, cells comes into the uppermost layer of the skin. This is known as a epidermis turnover time. And this epidermis turnover time, you will see multiple answer, because this is a very controversial MCQ. If I tell you a range, it is around 42 to 75 days. I'm quoting a standard textbook here. The range is a good answer. Okay, because this is vary from person to person. The range is the best answer. But you will notice that many textbook or old MCQ also gives this option, 8 weeks or 56 days. So I will say they should not ask this controversial MCQ, because in standard textbook itself there are multiple answers for this, but in the past this MCQ has been asked. Okay, so if you want to answer average is a 56 days or a 8 weeks, this is a commonly given option. So these are the different variant of the answers you will find in the standard textbook itself, but I will say this is the most profound answer, most right answer, which is a range, because person to person it will vary. Because in your epidermis the cells can reach into 40 days, in my skin it can take 60 days. It depends on person to person, but average time is 42 to 75 days. Now tell me, do you know any disease in which epidermis turnover time is decreased? Very important MCQ. Suppose my skin cells from the basal layer is coming too fast to the uppermost layer, then what will happen? I will have a very thick skin on my stratum corneum, right? If the cells are coming too fast, suppose it is coming in 10 days, what will happen to the uppermost skin? Yes, Sachin, you are right. So that is why what you have to remember in this MCQ, epidermis turnover time is decreased in psoriasis. It is decreased in psoriasis. Yes, Jitendra, you are right. It is decreased in psoriasis. So in psoriasis, it can vary in how many days. If the disease is severe, it can come into 3 to 5 days. Some psoriasis patient can have a 10 days. Okay, but ultimately this epidermis turnover time is decreased significantly in this patient, and that is why they have a extra skin coming up on their skin. Okay, on the affected area you will notice a patch is coming up. Clear? So in a nutshell, let's quickly go over what we just learned. We just learned about the first layer. Are you with me, guys? So the first layer is a stratum basale. Stratum basale has a vertical columnar cells. Then we have a stratum spinosum. As you can notice in this, stratum spinosum has a polygonal shape. What is prominent here? What is prominent in stratum spinosum? Spinosum is the spikes are prominent. Spikes are prominent. That is why desmosomes are prominent. Third is a stratum granulosum. In this image, you can see these tiny granules are present, and because of this is stratum granulosum. Then transparent layer, which is a stratum lucidum, and then uppermost layer is a stratum corneum. Okay, clear? So here let's just take a important concept. Important concept here is what we will be learning here is the basic understanding of the skin. Now we know is that the lower cells which are present in the stratum basale, they are young cells, and the upper layer are old cells. Okay, they are older cells in the uppermost layer. So in stratum corneum, these are the dead cells. In stratum lucidum, these are the dead cells. Yes, I will be sharing it. I will be sharing it. Don't worry. Okay. Okay. Now, Abhishek, try to answer this question. Desmosome are helpful in connecting. What you will answer? Easy question, easy question. Desmosomes are helpful in connecting. Yes, keratinocyte. Very easy question. Desmosomes are helpful in connecting keratinocytes. Okay. Nowadays they are asking a very clinical question, but the options, they are just giving you a panic attack by just giving you a history of a patient and everything, that you go into a deep thinking that this is a some difficult MCQ, but this is a one of the MCQ which was asked, and apart from this they gave you a history of a pemphigus vulgaris. In pemphigus vulgaris, because antibody is formed against the desmosome, so this MCQ was asked. Desmosome is important to bind keratinocyte. So what we will be doing is, we'll discuss about epidermis. Now we will discuss which are the important cells in the epidermis. So what are these epidermal cells? What are these epidermal cells? So the first epidermal cell is a keratinocyte. As you can see in this image, can you appreciate the polygonal shape of the keratinocyte? So generally 95% of my epidermis is made up of this keratinocyte. It contains an intermediate filament which is a keratin. So sorry. So suppose this is my keratinocyte. It has a keratin filament like this. It has a keratin filament like this. In this keratin filament, they are the internal structure, and is this keratin filament are bind with one important protein. They are bind with one important protein which is a filament aggregating protein. This is a filament aggregating protein which is also known as a filagrin. This protein is also known as a filagrin. Clear? So if there is a mutation in this filagrin, what will happen? The strength or a inside intercellular structure of keratinocyte will become very weak. So we will be learning about the genetic conditions in which keratinocytes are weak or fragile. So let me tell you, if this filament aggregating protein is mutated, or if this keratin filament is mutated, what will happen? The intercellular structure will become weak, and easily this keratinocyte can get ruptured because of the weak keratin filament. So we will be learning about this, but just understand one concept, important concept here is, I told you that two keratinocytes are attached on all the direction from the desmosome like this, and because of this desmosome my cell is a polygonal shape. Okay, so this is the outer strength. Okay, if desmosomes are strong, there will be a proper polygonal shape of the keratinocyte. And what is the intracellular strength? This keratin filament gives intracellular strength. Okay, this keratin filament gives intracellular strength. So to maintain my keratinocyte properly in stratum spinosum, I need both of this. Okay, let's understand up to this basic only. When we will be discussing about the disease, we will use this concept. Okay, now try to answer this question. Melanocyte is present in which layer? Melanocyte is present in a stratum basale. Melanocyte is present in a stratum basale. Let's understand about the importance of the melanocyte. So see this is the melanocyte. Melanocyte is one of the dendritic cells. Melanocyte is present in a stratum basal layer. Okay, important MCQ, let's discuss. Melanocyte is derived from it is present in basal layer. It is present in a stratum basale. Yes, it is derived from neural crest. Very important MCQ. It is derived from neural crest. Yes, it is a medico. It is a type of a dendritic cell. Why it is a type of a dendritic cell? See this. So this cell have a particular dendrites. So what is the use of this dendrites is, this melanocyte is producing melanin. Okay, how they transfer melanin is, with the help of these dendrites, it is transferring melanosome. So what is this melanosome? This melanocyte will produce some melanin. It will package into a melanosome, and these small packages of the melanosome will be transferred to the keratinocyte, and this keratinocyte now take this melanosome, open it, and have a pigmentation. So this is how they get pigmentation. So you all know the function of this is a melanin production. The function of this is a melanin production. amino acid which is required, for the production of this is a tyrosine. Sorry. And the enzyme which is required is a tyrosine kinase. So generally what will happen, this melanin is packaged into melanosome, and this melanosome is transferred to keratinocyte. This is known as a epidermal melanin unit. Epidermal melanin unit. So what is this? One melanocyte averagely transfer its melanin to 36 keratinocytes. Okay, 36 keratinocytes. And what is the important function of the melanin? The most important function, it protect against a UV light. This melanin protect against the UV light. Clear? Okay, just a second. Melanin protects against the UV light. Okay, now skin color depends on which factors? Skin color depend on which factor? This MCQ they ask. So can I say if a person has a more melanocyte, they will have a brown color, or less melanocyte person will have a fair skin? Sachin, Abhishek, Medico, Dr. Khushbu, Dr. Jatin. So always remember, let's understand that the skin color never depend on the number of melanocyte. So this MCQ was asked, the skin color depends on, the skin color depend on the function of how melanocyte works. As you can see in this girl, in her case, every cell is having a 2 melanosome for the pigmentation. They both have an equal number of melanocyte, but the melanocyte function is less, and because of this she will have a fair skin. Whereas in a case of this boy, in which this melanocyte is functioning more, as you can see in his case, every cell is having a dense melanosome which is packaged with the melanin, along with the degree of transfer is also high. Because of this, you can see in this case, this boy is having a more brown color skin. More brown color skin. Can you understand this? So that is why remember these three important points. Skin color depends on amount of melanin produced, number and size of the melanosomes, and the degree of transfer to the keratinocytes. It do not depend on the number of melanocyte. Very important MCQ point, because this MCQ has been previously asked. It do not depend on a number of melanocyte. Okay. Okay. Now move to the next important MCQ, Fitzpatrick scale. You just have to understand what is this scale is useful for. Generally, this Fitzpatrick scale is telling you about the risk of skin cancer. Okay. So in this Fitzpatrick scale, just understand it assesses risk of skin cancer. In this, as you can understand, a person who is having a fair skin is having a very high risk of skin cancer. A person who is having a pigmented skin, it is very likely to have skin cancer. Another important MCQ, what you will notice is, in this last group, generally they easily get tanning of the skin. Okay, so always remember, we Indians easily get tanning. Okay, that is why you will notice if you go in sun, you will have a tanning of the skin very easily, and that is why all these beauty parlors are earning money, okay, on anti-tanning facials and everything. So that is why always remember, these white skin will have a sunburn. So on Fitzpatrick scale, a person who is a white, they easily get sunburn, and the person who is a brown, they easily get tanning of the skin. This concept you always remember. A brown person will not have a sunburn. Okay, brown person will have a tanning of the skin. Okay, moving to the next important cell, which is the Langerhans cells. Langerhans cells. हाँ यार, काले है तो क्या हुआ? अरे काले है, कैंसर नहीं होगा, और दिल वाले भी तो है ही. चलो कोई बात नहीं. Langerhans cells. Okay. Next cell is a Langerhans cells. This Langerhans cells is a antigen presenting cell. Is a antigen presenting cells of the skin. It has a particular granules which is known as a Birbeck granule. Anyone knows any significant importance of the Birbeck granule? These are the tennis racket shaped. These are the tennis racket shaped granules. These tennis racket shaped granules are known as a Birbeck granules. Birbeck granules. In which disease you see this tennis racket shaped granule increased? Very important MCQ from the pathology and medicine both. Okay, In the terms of the dermatology, this is an integrated topic because it is a very important cancer. Anyone? Sachin, Abhishek, Medico. What is the name of the disease? It is a histiocytosis. It is a histiocytosis. This is also known as a Langerhans cell histiocytosis. MCQ they ask, what are the markers? What are the markers of this histiocytosis? The marker of this histiocytosis is S100, CD1A and CD207. And this MCQ was asked that CD207 is the most specific marker of Langerhans cells histiocytosis. Langerhans cell histiocytosis, most specific marker is a CD207. Okay. The third epidermal cell, which is a Merkel cells. Merkel cells. So where you will find Merkel cells? Merkel cell is also found among the basal keratinocyte. So how you will identify this? You will see a disc-shaped nerve ending which is attached with the skin. On top of it, you will see one cell which is known as a Merkel cell. This Merkel cell is a slow adapting touch receptor. So it is a disc-shaped epidermal cells which is connected to sensory nerve. What you have to remember is it is a slow adapting touch receptor. And because of this slow adapting touch receptor, what MCQ they can ask you, it is responsible for the fine touch. And because of this fine touch, the texture detection which you can do from your fingers is because of this slow adapting touch receptor. Okay, so these are the three important cells of the epidermis. The first is a keratinocyte, second melanocyte, third Langerhans cells, and the fourth is a Merkel cell. It is also, which is a nerve ending, sensory nerve ending. It is for the sensation. Okay, sensation. This is, we talked about the epidermis, but what you can get confused into is a second important nervous innervation of the skin, which is known as a Meissner's corpuscle. Meissner's corpuscle, you can see this image. Our skin is innervated by a different kind of nerve endings. Okay, of this, if you can understand this capsulated nerve endings, which is in the dermis area, generally it is not in the epidermis. So see this is my basement membrane. Below this basement membrane there is a capsulated nerve ending, and this capsulated nerve ending are known as a Meissner's corpuscle. So you just write down so you can remember the difference between what is a Merkel cell and what is a Meissner's corpuscle. So it is a located in a papillary dermis. It is located in papillary dermis. It is present on mainly on the fingertips. It is present mainly on the fingertips, palms, soles. It has a encapsulated nerve endings. It has a encapsulated nerve endings. And what is the main difference? These are rapidly adapting nerve fibers. These are the rapidly adapting nerve fibers. This is the difference. Okay, so they can ask you about the what is true in a Merkel cell and what is true in a Meissner's corpuscle. So they will give you some wrong option into this and you have to identify what is wrong. Clear? So see this. In my epidermis and dermis, in the physiology also, you will be learning about all types of these nerve endings. As you can see here, there are free nerve endings, raffinis corpuscle. So this will be covered in the physiology mainly. Meissner's corpuscle, what we discussed, these are the encapsulated Merkel disc or Merkel cells. It is present in the epidermis. Merkel cells are present in the epidermis, Meissner's corpuscle in the dermis, and this is a Pacinian corpuscle which is also present in the dermis. So these all sensation will go into the dorsal root ganglia, okay, in my spinal cord. Okay, so this is about the nervous innervation of the skin. So as we discussed up to now in epidermis, this is my stratum basale. Stratum basale is a germinal layer, active dividing cell layer. All the cells from the stratum basale will go into the stratum spinosum. In the stratum spinosum, I have spikes, and these are the spikes of the desmosome. Desmosome is also known as a acanthos. From the stratum spinosum, the cells will go into the stratum granulosum, stratum lucidum means transparent cell, and the dead skin layer, which is the uppermost layer, which is known as a stratum corneum. In this, we discussed about the cells. What are the cells? These are all are my keratinocyte. All the skin cells are known as a keratinocyte. In this, I have a Langerhans cell. This Langerhans cell is an antigen presenting cell which is derived from the bone marrow. This is my melanocyte. That is why I asked you a MCQ. Melanocyte is present in a basal layer. You can appreciate this vertical cell, and among these vertical cells I have my melanocyte. Along with the melanocyte, as you can see, this sensory nerve ending. With the sensory nerve ending disc shaped, this is my Merkel cell. And below this I have a Meissner corpuscle like this, which is in the dermis. This is my basement membrane. Okay, so this is a nutshell what we just discussed. Now, very important structure. Let's see this. We finished about the dermis. Now we will be learning about the finished about the epidermis. Now we will go down. At the basement membrane, below the basement membrane, you will have this wavy line. Can you appreciate this wavy line of the basement membrane? So suppose these are my this is the basement membrane. A finger like projection a finger-like projection of the dermis into the epidermis. Can you appreciate this? So I will take this yellow marker. Can you appreciate this? So this is the basement membrane. Okay. So this finger-like projection or finger-like a upgoing epidermis part, this is known as a dermal papillae. The tip of this is known as a dermal papillae. So a finger-like projection. So this is my dermis. From the dermis, you see any height. So these are dermal. This is known as a dermal papillae. Dermal papillae. But if I see from the epidermis, so from the epidermis, a finger-like projection going into the dermis. So this depth, a lowermost point like this. So the lowermost point from the epidermis into the dermis is known as a rete ridge. This is a very important finding because in histopathology I will be using this direct word dermal papillae, rete ridges. So at that time you will not be able to get it what is rete ridges and what is dermal papillae. Dermal papillae means from the dermis a finger-like projection into the epidermis. I will say it is a dermal papillae. A finger-like projection going down from the epidermis into the dermis, the depth or deep point of the epidermis, a downmost point, is known as a rete ridges. Clear? Okay. Now let's discuss about the basement membrane. We discussed about the epidermis. Below the epidermis I have a basement membrane. I told you this is the wavy basement membrane. On this wavy basement membrane there is a vertical cells, and on these vertical cells this basement membrane divide my epidermis and dermis. Few important point to remember about this basement membrane. It has a three important component. One is a plasma membrane of the basal keratinocyte, which is this side. So I will be marking this. The first part is a plasma membrane of the basal keratinocyte. Then there is a dermo-epidermal junction. So this is a dermo-epidermal junction, and this dermo-epidermal junction has a fibers down going like this, which bind tightly to the dermis. Bind tightly to the dermis. And in this we have one important protein which is a hemidesmosome. Hemidesmosome. In some disease this is known as a BPAG1. So BP230. This hemidesmosome is known as a antigen BP antigen 1 and BP230. The name is given because of the bullous pemphigoid. Bullous pemphigoid. BP means bullous pemphigoid antigen 1, bullous pemphigoid 230. Because in bullous pemphigoid antibody is formed against the hemidesmosome. So the three important part of the basement membrane is a lamina lucida, lamina densa, and the third is a reticular lamina. you just remember here the two important collagen which are present in the is the type 4 and type 7 collagen. Type 4, type 7 collagen and the hemidesmosome antigen. Okay. So these are the important points regarding basement membrane zone. Basement membrane zone. Generally, this basement membrane is a junction between epidermis and dermis. That is why it is known as a dermo-epidermal junction. The name of this is a dermo-epidermal junction because dermis and epidermis are joining here. Okay. Now, let's discuss about the dermis. So dermis, as you can see here, this is a wavy line. Can you appreciate this wavy line? So this is the wavy line. Above this wavy line, I have epidermis. And below this wavy line, we have a dermis, and this dermis is of two types. The first is a papillary dermis. The first is a papillary dermis. So what is a papillary dermis? It is a part of dermis. It is a part of dermis in the dermal papillae. It is a part of dermis in the dermal papillae. Whereas reticular layer, this reticular layer is very important. MCQ they ask. It has an irregular connective tissue. It has an irregular connective tissue. In this layer, collagen is randomly oriented. Collagen is randomly oriented. The main collagen which is present is a type 1 and type 3 collagen. Type 1 and type 3 collagen. The ratio of this collagen is 8 to 8 raised to 1. This MCQ is previously asked. In the reticular dermis, the ratio of the collagen from type 1 to type 3 is a 8 raised to 1. It has a elastin fibers. It has a elastin fibers. And which gene is involved? The fibrillin gene. Any disease you know which is associated with the fibrillin gene? Any disease you know which is associated with the fibrillin gene? Important MCQ. Marfan syndrome. Marfan syndrome is associated. Okay. Okay. The lowermost layer of the skin, which is a hypodermis. Hypodermis. Nothing much to say. Hypodermis, I already told you. In hypodermis, we have fat lobules like this. Along with the fat lobules, we have a septa. This is known as a paniculus. Paniculus. Any disease you know which causes the inflammation of the hypodermis? What is the meaning when there is an inflammation of the hypodermis? Any disease you know? Sachin, Abhishek. The inflammation of the hypodermis, if there is an inflammation of this fat lobule or septa, inflammation here is known as a erythema nodosum. This is known as a erythema nodosum. Okay. Yes, it is also known as a paniculitis there. Erythema nodosum is also a type of a paniculitis. But the important disease is a erythema nodosum. Commonly asked MCQ in medicine and dermatology, they ask this: what is erythema nodosum? You will see erythema nodosum in cases of sarcoidosis, tuberculosis, like this. Okay, there are few cancers which present with the erythema nodosum also. So what we will be discussing is a important dermatological terms. Important dermatological terms. Okay. Now, if you remember all the skin layers, it will become very easy to understand what is this important dermatological terms. Let's understand. The first is a hyperkeratosis. Hyperkeratosis. So what is the meaning of hyperkeratosis? Means keratosis. So which layer will be affected? Which layer of the epidermis will be affected in hyperkeratosis? There will be increased thickness of the stratum corneum, increased thickness of the stratum corneum. Yes. Sachin, do you know any example of physiological hyperkeratosis? Can it happen physiologically also? See, what is the meaning of hyperkeratosis? From my stratum basal layer, the cells in the uppermost layer, which is the stratum corneum, is very much increased. I have a too much skin coming up into the stratum corneum. This can be a physiological. What is the example of the physiological? When we have a callosis. So what is the meaning of callosis? You know, जब हम जिम में जाते हैं ना, in when we are doing gym, while we are lifting the dumbbells, what you will notice is after a few months, if you touch the skin of our knuckles, right? If you see the knuckles, this skin will get thickened. The reason is nature know that this person is lifting a heavy weight and this skin is having a excessive pressure, and because of this excessive pressure, what will happen? This will get compressed and the belowmost stratum basal layer will sense this and it will send more cells to that area which is bearing more weight, and that is why if you are walking barefoot, what will happen to the skin of the sole? It will get thickened because the person is walking barefooted. Because of the pressure sensation, nature will send more cells to that the stratum corneum, that the underlying skin is not getting damaged, that is known as a callosis. This is a callosis, means a hardening of the skin. Yes, but this is a physiological. But can it be a pathological? Yes. Pathological, what is the example? What is the example of the pathological hyperkeratosis? Pathological hyperkeratosis is seen in a psoriasis. Why? As I told you, in psoriasis, there is a decreased epidermis turnover. And because of the decreased epidermis turnover, when the epidermis turnover decreases, the more cell will come abnormally to the stratum corneum. And I will have a disease which is known as a the disease is known as a psoriasis. It is seen with the hyperkeratosis. Let's understand the second important dermatological term, parakeratosis. Very important. Parakeratosis. Parakeratosis, very easy to understand. What I told you, on my stratum basal layer, all the cells are nucleated cells. When they reach the uppermost layer, they become dead cells. In normal person, in a stratum corneum, there should be no nucleus. So generally, if my cells are reaching in a 42 to 75 day, which is a normal range, I will have only dead cells coming up in the stratum corneum. But if this patient is suffering from decreased epidermis turnover time, or suppose this is a patient of a psoriasis, what will happen? The cells which came to the uppermost layer will have a nucleus. So remember like this, retention of nuclei in the stratum corneum is known as a parakeratosis. It is always pathological. So if I ask you, parakeratosis is seen in which disease? It is easy to answer now. Parakeratosis is seen in which disease? Psoriasis, because cells are coming up immaturely fast, and that is why psoriasis has a parakeratosis. Okay, let's understand the third important histological pattern, which is a hypergranulosis. Hypergranulosis. So what is a hypergranulosis? Very easy. Increase in the thickness of the stratum granulosum. Stratum granulosum, if it is increased, it is a hypergranulosis. What is the example? In which disease you will see hypergranulosis? It is seen in a lichen planus. This is very important. The histopathological features of psoriasis and lichen planus. Every exam has one MCQ about the histopathological feature of the lichen planus and psoriasis. Okay. Hypergranulosis. And these lichen planus sign of hypergranulosis is known as a Wickham's-Stria. Wickham's-Stria. Okay. What is a Fourth important dermatological term, spongiosis. Spongiosis. So as the name is telling you, spongiosis means sponge. As I told you, in stratum granulosum generally give us a very important barrier function. In this barrier function, there is a granules, lipid granules, which is giving you a brick and cement model. But if this barrier is impaired, the pathogen can enter, or irritant like a strong detergent, strong any alkali can easily enter into the skin and cause inflammation. And if it start causing inflammation, what will happen? A water can enter in between the cells. Water can enter in between the cells. If there is a water is present in between the cells, now what will happen? It is known as a spongiosis. So the meaning of spongiosis is fluid between keratinocyte. Now give me one example which can present with the spongiosis. Which disease is present? Yes, it is an edema of the skin. Yes, it is an intercellular edema. So you can say it is a intercellular edema of the skin. You will see this in the atopic dermatitis. It is seen in a atopic dermatitis. It is also known as a eczema. It is also known as a eczema. Okay. Fifth important term, which is known as a acantholysis. Acantholysis. यार सचिन अब बताओ यार, what is acantholysis? What is the acantholysis? Anyone? What is the meaning of acanthos? In dermatology, we will say acanthos means what? What is the meaning of acanthos? Acanthos means desmosomes. In which layer desmosomes is prominent? Stratum spinosum. Stratum spinosum. No, Simran, acanthos means desmosome. Okay. So you go through the recording of the first hour. We discussed that this acanthos is a desmosome. This desmosome is a prominent in a skin layer, which is a second skin layer. So what is happening is, see this. This is my keratinocyte. This keratinocyte is being stretched by this spike protein from all the corner, and because of this, these cells are a polygonal shaped cells. Okay. Now what will happen if there is an antibody against this desmosome? So suppose I have some antibody which is destroying this desmosome. Now what will happen? If my desmosome are damaged, this cell will become round shaped cells because it has no connection with the other keratinocytes, and because of this, in between them there will be a fluid accumulation, and because of this fluid accumulation, you will see a total fluid accumulation above this skin or epidermis, and this patient will present with the bulla. This abnormal round shaped keratinocyte is known as a acantholytic cells. These cells are known as a acantholytic cells. Clear? These acantholytic round cells are also known as a Zang cells. So in any dermatology finding, you say you see these acantholytic cell or Zang cells, means round keratinocytes. This acantholysis can be of two types. So what are the types of the acantholysis? Yes, dear. The disease is a pemphigus vulgaris. Two types. The first is a primary acantholysis. So what is the meaning of primary acantholysis? In primary acantholysis, there is a direct damage to the desmosome, and because of the direct damage to the desmosome, you will have a round keratinocyte which is abnormal cells. And what are the example of this diseases? The first is a pemphigus vulgaris. The first example of a pemphigus vulgaris. Second, Darier's disease. Darier's disease. And the third is a Hailey-Hailey disease. The third is a Hailey-Hailey disease. In all these diseases, what is happening? There is a weak desmosome connection, and because of the weak desmosome connection, the cells are becoming round shaped cells. That is why it is known as a primary acantholysis. But tell me, what is secondary acantholysis? Yes, Sachin, you are right. Hailey-Hailey is also a disease in which primary acantholysis you will see. But what is secondary acantholysis? In secondary acantholysis, suppose this is the cell of the skin, okay? If this cell is infected, with some virus, suppose this is a herpes virus. So remember, herpes is a DNA virus and it causes a ballooning degeneration. So what will happen? Because this virus is causing a ballooning degeneration of the internal environment, this cell will swell. This cell will swell like this, and because of this, the desmosomal connection is lost. So what will happen? These two keratinocytes will have a accumulation of the fluid around it, and this patient will present with the fluid filled vesicle. So that is why in herpes infection, what you see? A fluid filled vesicle on the skin. Okay, so if I ask you, what is the example of a secondary acantholysis? Secondary acantholysis, answer will be a herpes virus infection. You all know, in any herpes infection, you will see a fluid filled vesicle all over the body, right? Either you take chicken pox, herpes simplex virus infection. In all these diseases, you will see a fluid filled cells, and these cells are known as a Zang cells. And that is why in microbiology, you remember Zang smear, right? So what is the meaning of Zang smear? By taking a biopsy from this area, you will look for round keratinocyte, which are the abnormal shape. Keratinocyte should be a polygonal shape, but if they are undergo acantholysis, it will become abnormally round shaped. It will become abnormally round shaped. So yes, Sachin, herpes zoster is also one of the example. Let's discuss. So we discussed about acantholysis. Now the sixth important term, acanthosis. Now tell me, what is acanthosis? What will be happening and which layer will be affected? Acanthosis. If I say acantholysis, it is a damage to the stratum spinosum. But if I tell you acanthosis, what will be happening? Increase in the thickness of which layer? Stratum spinosum. Increase in the thickness of the stratum spinosum. Any disease name you know with the acanthosis? Any disease name you know with the acanthosis? So how you remember? Acanthosis means desmosome. Acanthos means desmosome. Desmosome is prominent in which layer? Stratum spinosum. Acanthosis is associated with the increase in the thickness of the stratum spinosum. And the common example you have to remember is acanthosis nigricans. Acanthosis nigricans. Clear? Okay. Now few important dermatological term or abscesses we will be discussing. See this. What I told you is, in epidermis, dermis and hypodermis, we discussed about the important structures which are present. But if in this structure is epidermis or dermis or hypodermis, if there is an abnormal neutrophil, the collection of the abnormal neutrophil is known as a abscess. Okay, so collection of abnormal neutrophil is known as a abscess, right? So what is the meaning of abscess? Abscess means abnormal collection of neutrophil. So in histology, generally neutrophils are not present in the epidermis. Always remember, neutrophils are not present in the epidermis. If you see any kind of neutrophils present, it is abnormal. So we will be discussing about the two important disease finding. So abnormal neutrophil collection in a stratum spinosum. Anyone? What is this known as? What is this physiological finding? Histopathological finding, sorry. If there is an abnormal neutrophil present in a stratum spinosum, this is known as a spongiform pustule of the cogoj. If abnormal neutrophil is present in stratum corneum, if abnormal neutrophil is present in a stratum corneum, this is known as a Munro's micro abscess. This two abscess is found in a disease known as a psoriasis. This both type of abscess is found in psoriasis. If you found neutrophil at the tip of the dermal papillae, neutrophil at the tip of the dermal papillae. Anyone? What is this name of the disease? This MCQ has been previously asked. If you see neutrophil accumulation, so this is the dermal papilla. At the tip of the dermal papillae, I have a multiple neutrophil collections. In which disease you will see this finding? It is seen in a dermatitis herpetiformis. It is seen in a dermatitis herpetiformis. And the last is a malignant lymphocytes in epidermis. Malignant lymphocyte in epidermis is seen in a Portrier's micro abscess. Portrier's micro abscess. Malignant lymphocyte in epidermis is known as a Portrier's micro abscess. So we discussed about these important MCQs. These 9 histopathological terms all are important MCQ and previously asked question. You cannot go into the exam without revising this. Okay. So that is it for today. Okay. Thank you, Sachin, for joining me. Simran, Srijal, Dr. Kushbu, Dr. Jatin, all the students who have been watching, and make a use of these videos. It will stay in this channel. Okay. And I will be posting more videos like this. Make a use of these videos. After this, we will be going slightly faster. This was a slightly a basic, so I went very slow to make you understand all the important basics of the dermatology. Okay, once the anatomy and once all the visualization of the how the skin is anatomy is there, we can go more faster. We can understand the basic very clearly now. Okay, so this will help you to clear out your basics. Okay, thank you so much. So what we will be doing is, if you have any question, you can ask. Okay, thank you. So you can comment and I will be answering your queries. No, not right now. Once the few students are joining, I will give you a link. Yeah, I will give you. I will be giving you a Telegram link. Okay, for mine. Okay, in few days I will be giving. My team is working on it. Okay. So we will be in touch always, and till your exam, start learning a little bit of dermatology every day. On weekend we will be having these classes, so by the exam you will be master in this subject. Okay, bye bye, see you in the next session.